Barbara Myers. On today's show, we're going to be focusing on the situation when depression is particularly difficult in the winter months or at holiday time. Sometimes it's called Seasonal Affective Disorder. We have two guests that are going to help us to explore this topic. First, I'd like to introduce Dr. Akbar Galani, a board-supervised psychiatrist who is at Eden Medical Center in Castro Valley. And welcome, Dr. Galani. And our second guest is Mark Henriquez, who is a person who lives with seasonal affective disorder. So thank you, Mark, for being here. I'd like to start, Dr. Galani, by asking you some questions about some of the difficulties that people have with depression during the winter season and the holiday. What kind of symptoms do they have?
So the two cardinal symptoms for any types of depression is lack of pleasure in activities or interest and depressed mood. Mm-hmm. And that could be combined with decrease in concentration or attention, decreased appetite or increased appetite, loss of focus, and then depressive thoughts, feeling helpless and hopeless that I cannot overcome this situation. Mm-hmm. Many times at holiday time, people kind of suffer from headaches, fatigue, and tiredness. They're overwhelmed with this family situation, but they have to attend to family members and provide arrangements for parties or gifts. On the other aspect, seasonal affective disorder is a kind of an affective disorder diagnosed by DSM, mm-hmm. described by DSM, which is the patient starts to feel a lack of energy, increased sleep, and increased appetite, along with depressed mood. And that starts in fall, and it increases in the months of the winter, and by the time of spring, it goes away.
How long do they last? It sounds like it could last for the period of the winter time, and then in the springtime it would lift.
It would lift. Yeah. Most commonly that would be the case. But any time during that time, if the degree of the depression increases to the amount that our relationships are being impaired, our work is being impaired, and or we felt hopeless and helpless, then it's very important to seek treatment.
What do you think the causes are of having depression during the winter time?
Dr. Rosenthal initially came out with the diagnosis in a paper on seasonal affective disorder, mm-hmm. That because of the lack of the sunlight, it affects in the brain some of the neurons, and mm-hmm. that they secrete melatonin, and also the same neurons, they have less serotonin. Mm. And they looked at the effect of that in terms of the full spectrum light therapy, and because of the light treatment, these symptoms resolved. Mm-hmm. So we know much more about that. Mm-hmm. Nowadays, we also think that the seasonal affective disorder is not just because of the light, because also what is our blood chemistry is also, it also responds to the change in the light patterns, and so the neurochemical secretion in our body.
Are people at higher latitudes, do they suffer more, like in Scandinavia? Or?
Yes, a person in Boston would has more chances of suffering from seasonal affective disorder than a person in Miami or San Diego.
Maybe in the southern hemisphere it's the other way around, where
True.
They have it in our summer, then they're having winter.
Correct.
So they may have worse. A little bit later we're going to have a demonstration of light therapy, but can you tell us just a little bit about what it is?
So the light therapy is 10,000 lux full spectrum light, mm-hmm. Minus the ultraviolet radiation, because UV light can affect our skin and eyes. And Mark will can talk more about it, about his experience. Generally, we don't have to look at light, but we can do anything, like we can read or eat when mm-hmm. the light source is close to us. Mm-hmm. And even on a cloudy day, when we have some light, it's also good. Mm-hmm. Before purchasing a light of probably around $250 or $300, or Mark, you might know it might even cost more than that, we should consult our physician or psychiatrist that we are seeing.
During wintertime here is also a holiday season where there's lots of events and things going on, so there may be other reasons why people might have depressive problems at holiday time, because, as you mentioned before, the stress of family get-togethers and putting on lots of different parties and trying to, be around situations that you aren't around normally, that might be stressors at the winter time.
So it's not common that people would come in the office and they would say, well, it's our headaches, fatigue, we are so tired, we can't take the stress of what's going on even in an appearance of this office Christmas party. It's too much for me to deal with.
Yeah.
And on the other side, we also need to look at that we could have a pre-existing depressive condition or someone we have lost in the past, especially as we are getting old. We have lost a lot of friends and family members. So in this holiday time, we miss them because this is an event where we celebrate close with our families.
Yeah.
The third part is sometimes many of our patients would come in and they're recovering alcoholics, and they would say, it was very hard. I did a good job when I was making all these dinners and preparing a feast. In the past, I used to drink wine, but this year, I did not at all.
Okay.
So all these things we need to be mindful of, what our condition is.
It sounds like there are special challenges for people who are older because they may have loved ones who have died and that they, remember. And there's also challenges for people who have alcohol problems because a lot of the parties are filled with alcohol.
Correct.
Yeah, so, okay. Okay, what I'd like to do is talk with Mark a little bit about his experience with seasonal affective disorder. So when did you realize that you had this problem?
Actually, my wife first realized it probably about 5-7 years ago. And she noticed that my mood would get lower in the wintertime, and I was hibernating, is what she called it. And I'm not sure why I had the seasonal affective disorder.
Maybe a biological predisposition or who knows what.
It could be, yes.
Okay.
Nobody in my family has it, and there's probably someone that is undiagnosed.
What did you do when your wife suggested that maybe you had this problem?
Well, what I first did is I went to the doctor and explained the situation, and he had put me on antidepressants. But they weren't effective. I tried a variety of them, and they just didn't work. And then I did some research on the internet and found out about the seasonal affective disorder, and everything that I read just fit me to a T.
Oh, okay.
So,
okay.
yeah, I don't have a severe case of it. I have a mild case of it.
Yeah. Is there something that you found that worked?
Yeah, I found that just by getting out more during the winter time, and also by exercising more and using the light box, it really worked for me.
Okay, so we're now going to have a demonstration of the light box.
Okay.
Okay, we're here with Mark and his light box. So, Mark, can you tell us how you use this light box? We have it turned on. It's quite bright.
Sure, yes, I can. For this machine that I use, the recommended usage is about 30 minutes a day. Or, I'm sorry, 30 minutes a session at about 20 to 30 inches away from you.
So you sit pretty close to it then?
Yes.
Oh, okay.
Yes, you do. And the recommended time of day is in the morning around 6 to 8 a.m. And in the evening around 8 p.m. Some people, they find they only need the morning. The light should be indirect or at your side. You don't want to look into it all the time, but you can look into it from time to time.
Okay. So you'd sit in a chair and have this off to your side and read a
Yes.
newspaper or something?
Yes.
Yeah, okay.
Yeah, that's what I do.
Oh, okay.
Use it in a well-lighted room to avoid eye strain.
Mm-hmm.
And recommended that you first start off the light box 5 successive days, and then you can taper it off after that as long as your depression goes away.
Okay.
You should feel results within about a week.
Within a week, then?
Within a week,
Oh,
yeah.
okay. So is that what happened with you?
Yeah, it took me about 10 days to 2 weeks.
10 days to 2 weeks, and then your
Yes.
depression started to lift? or-
Yes.
Oh, that's,
And then you just use it as a maintenance.
yeah, that's cool.
Mhm.
So how did you go about finding this light box?
This light box I found on the internet. It was from Costco.
Uh-huh.
And they range in price from $100 to $200. And again, if you get a prescription from your doctor, generally your insurance will cover it.
Okay, that's good.
Mhm.
Let's see.
And they're widely available over the internet too.
So what if you were doing exercise or something? Would it help at all if you just had this in the room and turned it on, or would you have to be closer than that?
Yeah, you'd have to be fairly close to it.
Okay.
If you're maybe lifting weights or something and had it close by,
Oh, okay.
it would be, but it needs to be at about chest level,
Oh, okay.
so you get the full effect from
So,
it.
so it's like your eyes have to take that light in. or
Yes.
something. Yeah. Okay. Okay. Well, is there anything else you want to say?
Just remember that you're not going to be perfect with it, and adapt your schedule so it works for you. And it'll definitely make your depression go away if you have seasonal affective disorder. And one more thing to remember is that light boxes vary in their output. This is what they call a 10,000 lux light box.
Mm-hmm.
But if you have less luxes or more, the times will change.
Oh, okay. So you have to spend more time in one that has less lux.
Yeah, just follow the manufacturer's instructions.
Okay. Okay. Well, thank you very much.
You're welcome.
Very interesting.
Mhm.
Light box. Well, thanks for that demonstration. That was very
You're most
helpful.
welcome.
Are there other things besides the light box that you do, like try to stay outside when it's light? and
Yeah,
things like
I
that?
try to stay outside in the wintertime, especially during sunny days. Get some exercise, walk the dog around the lake.
Uh-huh. Okay. That's good.
Yeah, it's really important, especially during sunny days. Just kind of take advantage of them and try to get out
Uh-huh.
and get some light.
Yeah. So do you use I guess you use the light bulb box inside, and then you also maybe have it on when you're doing projects around the house and things like that?
Yeah, I generally use the light box in the morning, and I'll just read my newspaper or read a book or do anything, that I really want, that I can sit at the table. And I use it for about 20 to 30 minutes a day.
Mm-hmm. Okay.
So sometimes I can get by with it just once a week or twice a week, but normally when the time shifts in the winter, I have to use it every day.
So what would you suggest to somebody else who notices that they have this problem, or their family member that notices they have this problem?
The first thing that I suggest is that they get out and experience some sunshine when the day is sunny outside. Second thing I would say is try to make sure you exercise. And then the third thing is I would be creative in ways you can incorporate the light box into your day. It doesn't have to be at least after you do your first segment. It doesn't have to be rigid, but as long as you fit it somehow into your day, especially during the morning time, it's the best time. That's really helpful.
Dr. Delaney, have you seen the light boxes like this would be helpful?
Yes, and as
patients?
Mark talked about, that the important point that he talked about was to don't be rigid about when to use it, because then often there's the issue of non-compliance comes in. So to fit it around your schedule and whenever time that you are doing something else,
Right.
and you use it early in the morning, especially in those days where there's no sun out. Because oftentimes patients they use it and then it's hard for them to incorporate it in everyday life, and then they stop using it.
I guess I'd like to talk a little more broadly about what people can do in their lives when they're feeling difficulties during holiday time. And I have a number of suggestions that I'd like to get your comments on. One is keeping expectations for the holiday season manageable, so not being unrealistic about what you can do or what you can buy or how many things you could fit into one day. I mean, I had myself realized last week that there was one day when I had 3 different parties in one day. I finally said, I don't think I can do this, It's a little much, so it's learning how, and I'm still learning how to pace myself, so that was a lesson for me that, 3 parties in one day is too much.
So, and as Barbara, as you said in the past, like there's such a media hype about the holidays that we have this expectation that we should have a perfect holiday.
Yeah.
And everything should be just perfect, and it's not up to our expectations, and then we feel upset or we don't feel at par about it.
I guess you have to be sort of realistic about what you can do, and maybe not having the focus to be just one day, like just Christmas or just Thanksgiving or something, but the whole being around your family is important, and not just that one day being important.
Yeah, it's
now,
a holiday season.
Yeah, holiday season.
Not just Christmas or New Year's.
Right.
Mm-hmm.
Another thing that I'd like to suggest is that if people have had bad experiences in holidays in the past, leave the past, recognize that that was past, and this is the present, and we're going to try to do things different. I don't know if you have any suggestions for people who might have had difficulties in the past, family situations or whatever, and how they could change things.
It's not uncommon that people would go through, that there's a conflict between the siblings, divorces happen, kids are not talking, and in situations like that, it's important not to isolate, to get out of our home or place we're living at and interact with. We can volunteer, or we can provide in a homeless soup kitchen, we can help, or just go out and participate in some activity so we are not alone by ourselves. Oftentimes, as you realize, in terms of in depression, we have these negative themes, our ideologies in our heart, in our mind, that's what things are going in, and our depression fuels it.
Yeah.
So going out more, talking with people, talking to a therapist, maybe going in activities, and having socializing more, that will help us deal with it.
Right. Well, sometimes people end up spending more money than they have during the holiday season, and as a consequence, there is a lot of financial pressure. And so one suggestion that I've found is to try to find things that are free that you can do to enjoy, like going around and looking at Christmas lights, or window shopping, or making a snowman with your children, or something like that, that can be a wonderful memory for you to hold on to, that you could create, that doesn't involve spending a lot of money.
We had a patient today who was really upset that he's a grandfather and he has 6 grandkids, and these are hard economic times. People don't have much amount of money, so and kids, and so he was thinking all day long before he came to the appointment, how much money or gift he's going to give to his kids and to his grandkids. So, and he was very upset about it because he didn't have that all that money, and then felt down on himself. How come he couldn't do it? And he felt less of a grandfather. So much of the session we spoke and we talked about what to do. You are the most important person they want to have you in their life. And in the end, we agreed that he was just going to give $5 to the grandkids, and that's going to be enough, and have just to say thank you or say hello to his kids. So, and that he agreed upon. So that's very important, not to in terms of our over expectations that we should provide everything for everyone.
Your presence is the most important gift that you're giving.
Correct.
You know, so we mentioned before that sometimes there's lots of alcohol at these parties, and people overindulge, and excessive drinking can make depression worse. You know, it's a depressant. I don't know if you have anything more to say about that. Or,
It's a very important issue in terms of when we are dealing with any form of addiction. Many times in terms of alcoholism, people might feel lonely, or they might have on the other way around, they might have a lot of people coming in and they're around alcohol. So that will be a good time to have strategized what we are going to do. Are we going to talk to our sponsor about this? Are we going to tell our host that we are not going to, we are abstinent, and at the parties, hopefully, I mean, there will be no alcohol served. Or just not take ourselves to a party where alcohol is served if there's a chance that I will relapse. It's not really worth it on my health, that just for the sake of going to a party that I would jeopardize my health.
Right. If holiday traditions in the past have been problematic, you can always try something brand new, some new way of doing things that you hadn't tried before. You know, go to somebody else's house than you've been to before, or start some new kind of tradition, or do something different. Then another suggestion is to spend time with supportive and positive people in your life, you know, so that you don't spend time around people who are always down on themselves, or always down on you. Spend time with people who are supportive and can lift your spirits, you know. Here's one I like. Don't judge the value of a gift by its price tag. You know, so as we just said, the best gifts are first your presence, and second, gifts that are out of your sincere desire to make the other person happy. Homemade gifts are fine. Even if it's a very small gift, it's still okay when it comes from the heart. You know, people will know that. Another suggestion: you don't have to do everything that's asked of you. I need to tell myself that. You know, sometimes I tend to get overwhelmed by trying to do a lot of things for other people that I've asked, but I have to learn how to pace myself, and I'm getting there, but it's still, you know, I recognize that's one of my growing edges, you know. I don't know if you have any words of wisdom of how to handle a situation like that.
It's very important in our everyday life that how we would pace ourselves. People would really respect our boundaries in terms of when we would tell them ahead of time that this is something we are unable to do, we cannot do, rather than not being able to fulfill it or do it and not feel good about it.
For me, it's learning how to say no. Saying no to commitments that you can't make, and incorporating exercise into my day, or incorporating a time where I can be by myself, meditate, or do whatever.
And even if you have said yes, I learned this one myself, even if you have said yes to something, and then you realize, oh dear, I simply can't do this, that you can change your mind. You know? And people understand that. Another suggestion: your family is a real family. It's not a TV family. You know, things are going to go wrong, and the whole, there's arguments, possibly rivalries between siblings, and you can use this as an opportunity to learn how to accept and forgive, perhaps use this as a way to, instead of drive wedges between people, instead to learn how to get along with people instead. Sometimes things are going to go wrong, so when something goes wrong, say, okay, that's the thing that went wrong, instead of saying, I can't deal with this, and just realize that that's going to be a natural part of what the whole process is.
And oftentimes when things go wrong, it also gives us a chance to be innovative and do things differently without losing control. And oftentimes we can laugh about it, what happened, and they become a good memory.
Exactly, yeah. You mentioned this a little bit earlier, Dr. Kalani. If you can't be with someone that you love because of a divorce or military commitment or finances or some other reason, you can still find a creative way to make the holiday special, for like sending cookies or a gift, or I guess there's Skype now. You can do talk with each other, or you could arrange to have another day as Christmas, where you're going to celebrate. And then you can also ask your doctor about a light box. Now what I'd like to do is to give a challenge to those of you who are watching in the audience. Do you know someone who you believe might be suffering from seasonal affective disorder, or especially bad depression during the holiday time? And if so, it could be someone you know, or you could be yourself. And if so, what I'd like you to do is to think of the suggestions that Mark and Dr. Kalani have given, and think of how you might help that person or help yourself get through this time. So that's your assignment. I'd like to thank Mark and Dr. Kalani for being guests on this show. I think it'll be helpful to many people. And the closing words are from the Reverend Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching. We'll see you next time.